Welcome to Planetary Health First, Mars Next. We are on a mission to transform healthcare where all equally benefit by building a robust, dynamic, diverse community. So glad you could join us. Welcome, everyone, to Planetary Health First, Mars Next. It is an awesome Thursday, and today we have a special guest, John Criswell, and we're here an hour early. That's how special he is. It's so good we wanted to get an hour early out. My name is Michael Mann. I'm the host producer of this little thing. We're not going to Mars, but maybe, who knows? It's all about healthcare, really exciting, dynamic conversations, leaders like John. And while I'm not doing that, I'm the managing director of Desanti. We're a talent acquisition firm, and we're focusing in healthcare and IT and all things technology. So if you're out there and you need help, we can help you. And before we get started, give me a second. I'm not by any means the best bio reader, but this guy, John, he's famous to me, but probably not famous to everyone in the world because he's not on TikTok, Instagram. He's busy with a team building things, building a company, and he's done that before. John is an entrepreneur. John Criswell is an entrepreneur, investor, inventor, advisor, and he is the founder and CEO and chairman of Porter. John's newest transformative healthcare solution is Porter. Porter transforms the care at home journey for payers and their most vulnerable members. Powered by AI-derived insights, a dedicated clinical team, and a sleek member-facing platform, Porter delivers a smarter, faster, and more personalized way to navigate the complex at-home healthcare journey. And I can say amen to that because I used to be a social worker and a care manager, and my gosh, trying to figure out what meds, all the different things, PT, home health, we're going to find out all about all this. John was the founder and CEO and chairman of Pulse 8, the only healthcare analytics and technology company delivering complete visibility in the efficacy of risk adjustment and quality management programs. Pulse 8 revolutionized AI, machine learning, and analytics covering Medicare Advantage and Medicaid, and was the leader in creating analytics for the ACA Affordable Care, reducing unnecessary and wasteful interventions. John was recognized by the United States Patent and Trademark Office, Criswell John, at Methods and Apparatus for Risk Adjustment, United States Patent, which I will not read all the numbers because that's a long patent number, but you can find it later written. Pulse 8 was acquired in 2019 by a publicly traded company. Prior to Porter and Pulse 8, John was the director at Inovalon, a leading provider it's a cloud-based healthcare platform, growing it multifold. Before that, each time at COO, as a COO, he doubled the revenue of Right Time Medical Care, and more than that, doubled the revenue at Applegate Farms. John's career has spanned in multiple industries, including healthcare, consumer products, supply chain management. John is an active investor advisor to many healthcare organizations. So we'll stop at that. He definitely went to some amazing schools and has other things, but let's just stop at that and get going. John, it's awesome to have you here. Anything I left out, anything else you want to include?
Michael, that's great. Thank you very much. That pretty much sums up the professional side. So appreciate that introduction.
Well, let's get to the topic at hand. We have this amazing, awesome topic, which I think is so relevant: empathy amplified, harnessing AI and advanced analytics to drive at-home care in the digital age. That is a mouthful. Can you help unpack that, John?
Yeah, maybe, Michael, with a couple of stories. And it occurred with my own journey. As I think you're aware, I'm a fairly avid cyclist. And a little over 2.5 years ago, I had a fall, fractured my pelvis in 2 places. And as a result of that, I had to navigate the healthcare system. And I thought I knew something about healthcare, but it was a real journey, as you mentioned, from figuring out services, resources, and products that I needed to shorten my recovery. And I believe that all of us ask a very basic question when we're ill or injured. Chronic or acute. how quickly can I become the best version of myself? And my journey took me about 9 months. I learned a lot. And post injury, I asked, could it have been different? And the obvious answer was absolutely. Every interaction I had was very transactional. Understanding how I was diagnosed, understanding the treatment plan, understanding all of the pieces was one visit to the next. And I believe that you can shorten that, what we call speed to recovery, by acute and chronic condition, building out the pathways to shorten your care journey. Because we all want to be our best versions of ourselves, again, when we're ill or injured, as quickly as possible. I then have had many conversations with friends, with family, understanding their own journeys and the challenges, whether you are the patient, the member, the caregiver, the provider. How can we simplify our journey? And using analytics and data to connect that together is how we go about shortening that process, delivering better outcomes at a reduced cost to shorten the cycle. So we call it speed to recovery.
I like that term, speed to recovery, and I like how you were empowered to how can we become the best of ourselves? And from your own experience, you were really, I guess, motivated and like no other way to solve what we know needs solving in healthcare. Can you sort of unpack that?
Yeah, sure. So um, I'll start with from an acute standpoint. Once you have that first treatment and the plan is initiated, you really fall. Most of us fall into that gap of what's next and how do we manage it. Whether it's scheduling appointments, whether it's understanding the HME, the DME that we need. You mentioned medications. All of those pieces. Nobody is really quarterbacking that, and there's really no evidence of data that guides one's journey along that path. And so, what I became very aware of as I was going through my acute journey was that this could happen in a much more fast, expedited, efficient way and save me a ton of time. I was doing research through Google. I found a lot on what I had, but not actually what to do or what the treatment was for my condition. And so every step of the way, I'm leaving a physical therapist, I'm leaving my provider with bands and blocks and exercises. And I'd always ask, like, can't we do this up front? Can't we pull all of these pieces together so I can go off and deliver a 7 day a week plan so I can solve for my ailments? And I was always left with lacking, if you will, what that plan looked like. And that repeats itself over and over again. My son is dealing with a knee injury, and he's in that middle part of physical therapy and private training to rehabilitate his knee. I've seen that with my friends, unfortunately, who've been diagnosed with cancer and others. And I just simply say we can solve this by using a much broader data and analytic. Now, at the same time that we were thinking about Porter 2.5 years ago during that journey, I guess it started during President Trump and then was followed on with President Biden. Price Transparency, No Surprises Act, where both providers and payers are being inspired, being mandated to put price transparency data out into the world where we can connect and really see the total cost of care. And so while it's not perfect today, I believe that in the future, 3 to 4 years, these price transparency APIs, these machine readable files, both on the payer side and the provider side, will enable us to make much more smarter, data informed decisions across chronic and acute conditions.
So where can you share a little more about the price transparency? Because I know I was starting to talk with you earlier when you were beginning to start raising capital. It probably was about 2 years ago or a year and a half about price transparency really exciting you. Can you tell us a little more about that?
Yeah, well, I think it scares the facilities, the hospital systems, and the payers, frankly. And I think it's become very difficult to manage these data files. There's a lot of good companies out there trying to do some really interesting things with the data. Ultimately, I think the goal is for a consumer to be able to research whether it's a hip, knee replacement, any of the procedures, so you can see full end-to-end cost data. And I think that's the goal. Today, it's a difficult mechanism to get at the data. It's either an opt-in or an opt-out, making it difficult for members of the payers to get access to the data. And it's really complicated to make sense of the data. But I'm inspired because there's a lot of interesting companies, a lot of great people doing some really cool things to try and simplify and make that easier. So I think 2, 4, 5 years, we're going to see price transparency data so you can find what you believe in that spectrum of speed, cost, and quality, the best solution for you, whether that's a hip replacement on the West Coast or the East Coast, this facility or that facility. You'll have more data, more access to information to make better, smarter, more informed decisions.
It seems like not only would price transparency drive better decision making as a consumer, but it also would drive better delivery of care, right? If you know the cost, then you can create solutions. Is that something where you would come in as Porter? Wouldn't you say that that was kind of what excited you to kind of put those two things together?
Right. So from a supply chain perspective, and I view healthcare as a very complex supply chain problem. We think of pick two: speed, cost, and quality. You'll never get all three, so pick two. So if you're picking high quality and you're picking speed, then you may see the highest cost. And so across that spectrum, the best provider solution should rise to the top. Now, I think it's a complex mechanism to get to how you perceive and drive quality, but using those three components and pick two will evolve the best decision for your particular situation.
Well, I know we have a big topic to talk with this AI. I want to make sure we don't just go fully down price transparency. So I'd love for us to start with kind of this topic that we've decided that obviously is so important. If you would just want to start with us just doing a baseline with what this means. I mean, with the empathy being amplified, and then of course AI analytics in the home care. Just if you could begin with us with that.
Yeah. Well, I think piecing apart the empathy, and anytime that someone has a chronic or acute condition, how do you? Sorry, Michael.
Yeah, I'm here.
Okay. Anytime someone has, whether it's acute or chronic, I think we have to lead with empathy. And so from a digital starting point, we often miss that connection. And it's very difficult in today's world, whether it's healthcare or outside healthcare, to get anyone on the phone to address your particular concern or need. And so we always start from an omni-channel perspective, but making available that human connection. And so we believe the patient, the member, is first, and we can drive value to our customers, our payers, but member-centric approach and following, if you will, the CMS directive from a Medicare Advantage standpoint. They are clearly driving towards a member-centric approach when we think about things like social determinants of health, SDOH. If we're thinking about health equity, if we're thinking about transportation, food insecurity. So empathy is center to everything that we do. And by putting the member first, we can achieve the value that the payer and the health system requires, that needs for its financial feasibility going forward, but gaining the value from a member-centric, empathetic approach. So that's, if you will, cornerstone one to our cause motivation, our purpose, our mission. So empathy for the member first. So that's number one. Number two, as you think about the disparate silos that exist between not only health delivery and insurance. Insurance has its own distinct silos. So you have, if you will, network, you have risk adjustment, you have quality, you have care coordination. And how do we stitch each of those together to drive value to those particular components within a payer that has a one-touch component to the member? So we're going to connect the network to drive what that member needs for specialist or primary care, to support the quality components around diagnostics, kits, to support the financial mechanism around risk adjustment, and then finally, a very high-touch concierge connection to that member. So they're getting value while the member is getting value. And that is essentially the goal through this high network. And if you follow, which I know that you do, Michael, CMS and OIG, I believe what they are clearly messaging is a member-centric approach, driving payers closer to the healthcare delivery side, pushing quality and SDOH, not just in stars, not just around quality, but also I believe they're messaging in the future that risk adjustment will have a higher SDOH component in the future.
Where are you seeing yourself with Porter going with the SDOH? Is there something right now that you guys are at the core doing when you what is that driving for you?
Yeah, well, I think at a starting point, it's very difficult to get appointments, and members have needs, and we're seeing members as an industry. We're seeing members, we're communicating with members, we're sending members letters, text messages, telephone calls. How do we create a 360 view of what that member needs? And then as a result of that view, that means taking all of the survey data from food delivery, from transportation, from the things that are occurring with that member in the community, and then activating upon what that member needs to drive cost, to reduce cost, to drive value. So one example is transportation. Many of the Medicare Advantage, Medicaid members, and those that find themselves in the ACA that are sick or ill need transportation needs. So can we connect them with that benefit? And we assure them of the support to and from their visit. If they have had an acute event and that acute event has led to meal delivery, and that meal delivery provider is connecting a survey, can we take that survey and then execute upon what was uncovered in the home? So that could be things like transportation, food insecurity, fall risk in the home. And then as a result of those activities, is there a benefit that corresponds to support that? Does this member need a PERS device? Do they need another benefit? Do they have a isolation concern that we can support? All of those things around that member that we can raise in one concerted effort, so we're not touching them in ways that is driving less engagement, but more powerful singular engagement as a whole.
It seems like the way you are doing things, it's just intelligently designed, continuing to meet those members on that care journey by informing your analytics with the network, with the services, with the solutions, because otherwise that's the discoordinated care. It just doesn't happen. Who's the owner of that? And so that's what Porter's doing. I mean, it's the Porter is that what brings you what you need when you need it. I mean, if you know,
we've been really touched. Many stories. We had a cancer member last year, and based out of Utah, and wanted his oncology treatment at Johns Hopkins here in Baltimore, where I'm based in the state of Maryland. And so he was here for 6 to 8 weeks, and unfortunately was diagnosed with a second cancer, and he wanted to get home and back to Utah and have the secondary cancer treated in Utah. And we supported that journey all the way to Utah, helped him with all of the things that he needed. And one of the things we uncovered through the data that we saw in his benefit structure through the price transparency component was that he had a $500 dietary supplement benefit that he wouldn't have known. And I'm fairly certain his oncologist may not have known. And so when we inform him of this, to actually have the script filled, and then we can support that. Those are gaps that they just would not have known that we can support. That nutrition is so important for cancer patients. We had another member in the Midwest who was discharged from a long-term care facility, and he was at home. He was discharged on a Saturday, unfortunately. Very complex GI, lots of chronic conditions. And as we were going through our assessment with him, we asked about the medications that he was prescribed. It turns out that he was a vet, and Saturday and Sunday the VA was closed, and he couldn't afford his medications. And we called the hospital and we said, hey, we need 48 hours so he can make it to the VA on Monday to have his medications filled. And that's what occurred. Now, surely he would have been readmitted to the hospital on Saturday or Sunday. So we avoided an emergency department visit. Unfortunately, we didn't ask the right questions during discharge, and he couldn't afford what he absolutely needed. And so when we were there supporting him at the home, we made it happen for him. And that plays itself out over and over again. And these are the types of things that this high touch that drives tremendous value for the member, because the last place and the patient, the last place they want to be is back in the emergency department on Sunday. And the payer and the health system certainly are inspired to reduce readmission. So that's that value and that cause motivation that really inspires us to do well every day.
What's really encouraging hearing those specific examples and really just delivering care. I mean, I know we're all frustrated. You speak about access of care. It is hard to get appointments, and then just really closing those gaps. I wanted to take a question from the audience, and I know she's a good friend of yours, a good friend of mine, I can say too, Stacy Mays. She's got an interesting question. And everyone, this is not scripted. We're not paying anyone to come on. This is real and live. Maybe one day, who knows, but not today. So Stacy Mays, she's asking, you're crossing a lot of fiefdoms in the plan world. How are you gaining traction with so many parts of an org have to, I guess, with the buy-in? So tell us this, I guess that would, anyway.
Yeah, Michael, first, thank you, Stacy. She's a wonderful friend and somebody I consider unbelievably wise and smart and brilliant when it comes to the payer arena. And it's a fantastic question. I would say very simply, we're touching those 4 areas, more specifically the risk and quality, and those payers that see the value between pulling together quality stars, risk, and care coordination, and are aligned, and how each of those care gaps, quality gaps, star gaps, and risk gaps align and connect to a particular member, they get exactly what we are doing, why we are doing it. And unfortunately, many are struggling with reductions in engagement, meaning members really aren't engaged. And so they band together and break down those silos and those barriers to engage in something that's like Porter. There are some great examples out there, I think, of payers that are 5-star that are doing these types of activities that I admire and follow closely. But you're absolutely correct. There are silos that exist in today's market, and our methodology in terms of how we engage is to implore upon our prospects and our customers how important this is. And many of them understand that engaging members is essential. That was a great question.
I have a question. I don't want to, create a problem. But who are typically your influencers or your champions in the field, and then sometimes your naysayers, if there is a persona?
Yeah, well, Michael, it's a great question. So I consider myself a reluctant entrepreneur. I've worked for a lot of great CEOs and entrepreneurs. I learned a lot. But when I started my first company, I would go to one conference after the next and talk about how to use data and analytics to eliminate things that were unnecessary and wasteful. And ultimately, that's the patent that you were reading off in the bio that was approved. That was a difficult time, the first 2-3 years, talking really against the industry and how it was, if you will, orchestrating risk adjustment. But I was confident, not undeterred, to push forward an agenda, knowing that the ACA would have somewhere to a 17-20% illness wellness burden with much larger populations. And you had to be more precise. So coming back to Porter, what I've come to appreciate is that many times when we start with the risk and quality group, they gravitate quickly to, why am I doing so many activities with a member? They see the data and they want to begin to consolidate and execute against. There are certainly what I would consider tailwinds behind us being driven by CMS, with the patient, the member as being the center. And what I believe, and I mentioned earlier, that risk adjustment will drive more towards an SDOH, forcing insurers to do something that they weren't necessarily designed to do in the beginning, which is engage deeper into the delivery side. The naysayers are going to be the naysayers. We often look at the publicly available data on where they're trending well with their stars and qualities and where they're suffering. And I think whether you're a commercial, Medicare Advantage, or Medicaid, I think we all know how difficult it is to do things like just get appointments, right?
Yeah, I know the little I know in healthcare that 5 stars, oh, is the holy grail. And how do you do that? Is you've got to use certain solutions, whatever it be. And so I imagine that's a big driver of Porter success, as it, when you also unpeel all the onion layers, there's way more to that. But I imagine, are you finding that there's still enough interest in the plans to know the common sense and logic in that, or not?
I think I think payers have so much on their plate today, coming from a lot of different vantage points, and we view ourselves as Switzerland, as the ability to stitch and augment together the disparate components and pull those pieces together. I just attended a conference. There were amazing presenters, experts in their field, from risk, quality, network, compliance. And one of the themes that I heard and stitched together through that is, how do we drive more compliance, more support, and care for our members, knowing the challenges that exist? I heard some really interesting concepts. One payer in particular, I'm as I mentioned earlier, on the practice administrator side, I'd worked in urgent care and primary care for a brief stint, a couple of years. How do you drive urgent care as part of the payer puzzle? I heard a great case study from a payer who's doing fall risk assessments in urgent care facilities in their state. I think that's fantastic. And as a result of that, they're capturing stars and risk adjustment gaps through a urgent care facility. It's something I've been talking about for over a decade. I think it's a fantastic opportunity. Those payers that are evolving and doing new and unique things will get there.
I love hearing about the fall risk, because that's, my dad's 90. I can't tell you how many times he's fallen. I mean, it's just, it is what it is. And my mom is 84. She fell, and thank goodness. I mean, it's just it's so common, and it's it's so hard. It's such a complicated situation. And we know that gait training, we know that physical therapy, all these things, but still, um, older adults fall. And so, anyway, I just, it's real. All of us are dealing with it. Um, and so, anyway, I don't want to get all, I'm kind of going down off the rabbit hole, but what going back to the AI and the tell like let's go deeper in this, because you're even though this is a high touch, you have guides that I think is really fascinating. You're kind of augmented real people, real guides helping along the journey using these solutions. What I would be interested is, I know you don't want to give away your patents, your secret sauce, but it would be great if you could just share a little more some more of that technology.
Yeah, well, Michael, I have followed I think like many individuals have followed your journey that you've shared regarding your father. And I guess I just learned of your mother having a fall recently. And as you said, I think it's a very real issue, not just in the senior population, but I've had a number of falls myself, and they can be very scary. And so those 9 fall risk factors are things that we should pay attention to and try and support for our members and give them the right guidance. And there's some interesting companies out there that are doing some really cool things around PERS. When it comes to, now to your question, when it comes to the platform, we're using speed, cost, and quality. We're looking at services, resources, and products by chronic condition to serve up what we believe will be the fastest path to your best possible life. And so if you are a CHF patient, for example, or a COPD, or someone like myself who had this acute fall and fractured my pelvis, these are the educational components, the things that you should do, the things that you should purchase. And oh, by the way, here are those items that are covered within your benefits. And here are the things that are out of pocket expenses. So you can then map your best possible recovery. And so we're looking at this by chronic condition, by acute condition, to support the payer in reducing a member's outcomes. On the flip side of that, when we engage with a member, we're educating, we're spending 30 days with them, sometimes longer, helping them through that care journey so they can have the right PCP, the right specialist, all of the covered items that supports their journey, that each of our payer clients believes reduces the overall cost, but supports their healthy return.
Could you share what it looks like, the onboarding when you start with a plan?
Yeah, so many of the payers have a fairly exhaustive data set. And so we're taking not only claims data, we're taking their CAPS, HEDIS, STARS, their risk adjustment data. We're working with any of their survey data, whether it's transportation, food, any of the community resources, and we're beginning to create that patient member profile. We then provide a cohort analysis back to our customers. That cohort analysis provides what we think should occur with that member, and then the payer approves that and then submits to us how they would like us to engage with those members. Oftentimes that starts with a phone call to the member. It can also be a letter, text message, an email, but typically it starts with a phone call. And going back to that empathetic part, we're there to serve them. So we go beyond just the things that they are, the payer is prescribing to us, but we support. If they need to find somebody to cut their grass, we'll help them do that. We are there to support them, because ultimately those are the things that deter them away from their healthcare focus. On the TRC side, we're connecting with and have connected with various HIEs and other data sources. So when a member or patient is admitted into a facility, we're triggered. We call either their discharge planner, their caregiver, or the member patient while they're in the facility, and we'll advise them of what we do and how we're there to support them. We have about a 75% engagement rate, and then we support them all the way through their transition to home. We help them make sure they have all of their HME. We schedule all of their follow-up appointments. We make sure they have all their medical records, that their providers have their medical records, and we support all of the gap closure activities, both on the quality stars and data integrity side.
Wow, that's impressive, all those things you do. Lindsay has a question. She's a pharmacist, Lindsay Dixon. I do not know her, but she's really impressed with this conversation. And as a pharmacist, she definitely finds that there's a lot of utility for AI with home care. So I don't think that's really a question, but if you could sort of take it into a question, I think there is something there.
Yeah. Hey, Lindsay, thanks. Oftentimes pharmacists are on the front lines and they see different aspects of that patient's return to care, right? I often walk into, whether it's a CVS, a Walgreens, local pharmacist, and what do I see around the end caps? I see walking devices, I see PERS devices, I see a whole host of other things. And I'm not sure if it's possible today, but if the pharmacist has that opportunity as they're consulting their patients to support them with the things that may be benefits or defined contributions, quarterly incentives that are connected to a payer's plan to make smart purchases. So if you see somebody that might have, as Michael mentioned, a gating problem, and they're taking a medication that might unfortunately deter their or increase their fall risk, perhaps if they have that defined benefit and that knowledge, that access to that benefit is available to you, to recommend buying a walker or a cane or something to support to reduce a fall, as an example.
Yeah, I would just add there is something amazing about a few little assistive devices. What is a rolling walker, standard walker, a raised toilet seat, and a shower bench. My gosh, that is relieved so much. We have a caregiver for my father, but that toilet seat, that raised toilet seat, creates so much independence for him getting up from the bed with his rolling walker. I mean, it sounds so silly, but when you're there and you've experienced firsthand, it's magic. And he did not want to do it, and I'm sorry if my mom or dad's watching this, forgive me, but I'm using this as an example because pharmacists could really be part of that gaps of care solution provider. So anyway,
Mike, I'll
yeah.
maybe opine a little bit on that. So my last company, Pulse 8, we started out predicting fall risk, and we built several algorithms around fall risk, and we ended up kind of pivoting. The idea, the concept was to be able to help seniors in their journey to eliminate things like you just mentioned. And unfortunately, what happens is when you engage with your family member, whether you're a caregiver, a son, a daughter, etc., is they often reject that notion because it feels like they're lacking agency, when you're actually giving them agency with removing loose rugs, eliminating shower curtains, sheets, bed sheets, things of that nature. So I hear you loud and clear.
And I imagine your guides, your care guides, have become very nuanced and very skilled at doing that. The empowering, not dehumanizing, but to empower, because it's such a finally, when my dad realized, and I think pretty much it's universal, older adults, that, man, the shower bench, I can go in the shower. I mean, it was like, wow, he didn't want to get out. So it's the same thing. And anyway, I know we're coming towards the end. We got about 5 more minutes. I want this to just be Porter going to the moon, going to the Mars, shooting out. What are some things, some takeaways, anything last minute, just importance that you're doing, anything you'd like to share with our audience?
Well, I think most that are engaged in both healthcare delivery and healthcare insurance want to do the right thing. And I think we're getting pushed there by CMS. And I think we can. I think we can do more. I think we can achieve more. I think we need to be inspired to look beyond what traditionally has occurred with how we intervene with members. I think we need to go beyond digital solutions and activation. More is needed in the home. More can be achieved in the home. And that value, if you take a different perspective from a payer-centric to a member-centric focus, I believe you can accomplish your 4 key drivers, which is better outcomes, better retention, better stars and quality scores, and better diagnostic reliability.
I like that. So I think we're at that time. I'm going to send us off with our little ending note. Friends, but first I want, how do people get in touch with you? What's the best way? John, I really thank you for this. I really appreciate you coming on. It's been a pleasant experience, knowing more what you're doing, getting our audience to hear. Can you just share what is the best way for people to follow up with you and get in touch with you? Tell us about that.
Yeah, LinkedIn is easy. I'm on LinkedIn. Listen, feel free to drop me an email at john.criswell@helloporter.com.
Awesome. Awesome. Well, we're going to wrap it up. It's been such a great journey today on Planetary Health First, Mars Next. Feel free to follow us. Just type in Planetary Health First, Mars Next on the internet. Until next time.